Let us now go to face reading. The topic is tonsillitis. Tonsillitis is a nonspecific acute inflammation of the palatine tonsils. It is often accompanied by a degree of acute inflammation of the pharyngeal mucosa and the pharyngeal lymphatic tissue. At the acute onset, the patient feels severe pain in the pharynx radiating to the ear. The pain is aggravated when swallowing. The illness is often accompanied by a high-grade fever, aversion to cold, and head and torso aches. If the illness lasts a long time, the patient may have a dry, itchy throat, difficulty swallowing, the sensation of a foreign body lodged in the throat, or a recurrent sore throat and fever. Chronic tonsillitis is mostly the result of delayed treatment of acute tonsillitis. Face reading. If earlobes turn red within a short period of time, it indicates an acute attack of chronic tonsillitis. The tongue manifests redness, a thin yellow tongue coating with a dry, painful throat, difficulty swallowing, fever, and cough. Here we can see in this picture where the earlobes turn red. Here we can see the tongue manifests redness, a thin yellow tongue coating. Therapeutic methods. Consume a light diet and eat foods that clear away heat and soothe the pharynx. Avoid pungent, irritating, raw, and cold foods, and avoid smoking and alcohol. Maintain oral hygiene by gargling with light, salty water after meals to reduce the risk of oral bacterial infections. Massage. The lung 6 point can assist with the treatment of tonsillitis. Use the pad of your thumb to massage the lung 6 point for 3 minutes, 3 times a day. Perseverance in massaging this point can dispel lung heat, help lung qi descend, and clear orifice collaterals, eliminating swelling, reducing pain, stimulating sound, and clearing the throat. Thank you so much for your attention.
Let's proceed to the second part of the case history on migraine as we continue with interviewing. The pale color of the tongue and the weakness and emptiness of the pulse confirm blood deficiency and kidney deficiency. However, the swelling of the tongue body and the sticky coating points to phlegm, something that was not apparent from observation nor interrogation. Her thin body indicates a tendency to blood and yin deficiency, while phlegm usually manifests with a tendency to being overweight. Furthermore, she had no other symptoms of phlegm. There was no dizziness, no blurred vision, no feeling of heaviness of the head, no dull headaches, no expectoration of phlegm. However, in these cases, we never discount the tongue signs and concluded that although she had no other symptoms of phlegm, the tongue signs were clear enough to confirm the presence of phlegm. This is confirmed by the aggravation of the headaches in damp weather. The simultaneous presence of liver yang rising and phlegm is a very common cause of chronic headaches. The character of her headaches points very clearly to liver yang rising, which is confirmed by the throbbing nature of the pain, the nausea and vomiting, the sensitivity to light, and the location of the headache on the gallbladder channel. We can therefore conclude that the causes of the rising of liver yang are the blood and kidney deficiency. The former constitutes the manifestation and the latter the root. From the point of view of deficiency and excess, the former consists of the blood deficiency, kidney deficiency, and also spleen qi deficiency, while the latter consists of liver yang rising and phlegm. We can deduce the presence of spleen qi deficiency from the presence of phlegm and from the weak pulse. The pale color of her tongue body can be attributed to any or all of her deficiency, that is blood, kidney, and spleen qi deficiency. The redness of the sides confirms the rising of liver yang, and the swelling of the tongue body and the sticky coating indicate phlegm. The last aspect of her tongue to interpret is the peeled patch on the left side in what may, under certain circumstances, be the breast area. There are two ways to interpreting the significance of this peeled patch. It could indicate either the very beginning of immune deficiency, which may develop from blood deficiency, or a problem on the left breast. This could be a problem in the left breast, such as mastitis, developed after childbirth. However, the patient said that this was not the case. The other possible explanation is that a peeled patch may indicate a more serious potential problem in the left breast, such as a malignant lump. In this case, we need to treat both the root and the manifestation simultaneously. The root by nourishing blood, tonifying spleen and kidneys, and strengthening the penetrating and directing vessels, and the manifestations by subduing liver yang and resolving phlegm. Thank you for your attention.
Let us now go to auricular acupuncture. The topic is history and theory. Auricular acupuncture, or ear acupuncture, or auricular therapy as we know it, is one of many forms of acupuncture. It is a distinctive part of Chinese medicine that has been practiced in China for thousands of years. Auricular acupuncture is employed in the treatment of pain and certain diseases by placing fine needles in specifically designated puncture points on the external ear. It is simple to apply with minimal side effects and often achieve good results. It can be an economic alternative form of patient care with broad applications. The relationship between the ear, internal organs, and the meridians, or the acupuncture channels, was first reported more than 2,000 years ago in Huangdi, Neijing, as it is said in Chinese Canon of Medicine. It was compiled during the Warring State period from 475 BC to 221 BC. In a chapter entitled Kuwen Pian in the Book of Ling Shu, also in the Chinese Canon of Medicine, the ear is described as a central location where numerous meridians meet. When there is internal pathology, whether pertaining to a specific organ within a body system, the auricle can exhibit external changes such as discoloration, tenderness, decreased electrical resistance in the corresponding meridian pathway within the ear, and even mild morphological changes or scarring over time. Inversely, one can also use these changes expressed by the auricle to detect internal organic or systemic disease, the so-called auricular diagnosis. The development of acupuncture anesthesia was also based on the analgesic effects on internal organs and the whole body systems by stimulating the corresponding area of the auricle. Dr. Paul Noget observed this phenomena in a patient with chronic sciatica who also had scars on his ears. The patient was able to relieve his nerve pain by rubbing certain pressure points on his ear. In the 1950s, Dr. Noget mapped these auricular acupuncture points and the corresponding somatic representation in the body by developing an inverted fetus map of the external ear, similar to the somatosensory homunculus of the brain. Here we can see in figure 8.1 the fetus map in the shape of right ear. And figure 8.2 is a rear view of left ear. And here we can see the homunculus of the brain. During the 1950s in China, primarily due to shortages of healthcare provisions for the Chinese population and underdeveloped Western medicine, general acupuncture, including wide-scale use of auricular acupuncture therapy, was utilized for the treatment of acute and chronic pain, as well as treatment for certain diseases like asthma, hypertension, etc. Auricular acupuncture was also used as a form of adjuvant therapy in conjunction with narcotics administered for anesthesia. At the time, acupuncture research, particularly auricular therapy research, was highly encouraged by the Chinese government. Thank you so much for your attention.
We go to differential diagnosis for hiatus hernia and acid reflux. Let's start with the Western differentiation. Hiatus hernia and acid reflux occur when the portion of the stomach. This is about hiatus hernia. Hiatus hernia occurs when a portion of the stomach protrudes upward into the chest through an opening in the diaphragm. It is a very common condition and most often seen in people over the age of 50. The mechanism which stops acid from regurgitating into the gullet from the stomach stops working. Acidic stomach content moves up. That is why we have acid reflux into the esophagus, damaging its lining, leading to esophagitis and causing heartburn. Signs and symptoms: heartburn, which is worse when bending over or lying down, difficulty swallowing, chest pain, and belching. Underlying causes are obesity, contributing to the weakening of the supportive tissue, smoking, congenital. Children with this condition usually have it from birth when it is associated with regurgitation of food soon after feeding. The babies usually remain comfortable and thrive. Most cases clear up by the age of 9 or 10 months. Other causes of acid reflux are peptic ulcer disease, acute and chronic gastritis, excessive consumption of alcohol, dyspepsia, pregnancy. Complications: slow bleeding, iron deficiency anemia, and pulmonary aspiration. Now let's go to the Chinese differentiation of hiatus hernia and acid reflux. Diagnostic questioning according to organ differentiation. This is primarily the co-cycle relationship of wood and earth. According to aggravation, so if the condition is aggravated with stress, this is qi stagnation. And if the hiatus hernia occurs with heating foods like alcohol, coffee, and chocolate, this is stomach and liver heat. Hiatus hernia with bending or lying, this is spleen deficiency. If the condition occurs with a cold or flu, this is lung qi deficiency. With eating, food stagnation, phlegm damp heat. With emotions and stress, stagnation of liver qi, yin, or blood deficiency. With palpation, blood stagnation, damp heat, qi stagnation. Diagnostic questioning according to amelioration. So if the hiatus hernia is improved with belching, this is food stagnation or qi stagnation. The acid reflux, rather. Etiology: diet, eating large quantities of heat-producing foods, irregular eating habits, not chewing food properly. Emotions like anger, frustration, and worry affect the spleen, stomach, and liver, thus resulting in acid reflux. Being overweight will easily bring about hiatus hernia, lack of exercise, and tight or restrictive clothing as well. Zhangfu patterns for hiatus hernia and acid reflux. Excess patterns include liver qi invading the stomach, liver fire blazing, stomach fire, phlegm damp, stomach qi ascending counterflow. Deficiency patterns are spleen and stomach qi or yang deficiency, stomach in deficiency, liver in deficiency. Thank you for your attention.
Let's talk about the relationships among Zhang viscera, the liver and the spleen. Here we see the relationship between the liver and the spleen, as is demonstrated mainly in two areas: the digestion of food and the circulation of blood. So we know that the liver is the one that stores the blood and is in charge of conducting and dispersing for the digestion of food, while the spleen is the one that commands the blood and transports and transforms also for the digestion of our food. These two work together so that the nutrients flow properly through our blood. So let's talk about digestion of food. The spleen governs transportation and transformation, and the liver governs conduction and dispersion. The normal ascending-descending of the spleen and the stomach depends upon the movement and regulation of liver qi. The close cooperation between the liver and the spleen ensures the proper digestion of food and drink and the absorption and distribution of the essential nutrients. If stagnant liver qi compromises the spleen's ability to transport and transform, there may be chest and epigastric tightness, loss of appetite, abdominal distension, mucoid feces, and heartburn and eructation. If the spleen is deficient and fails to transport and transform, water and dampness can accumulate and engender endogenous heat. When dampness heat overpowers the liver and the gallbladder, bile can overflow into the skin, causing jaundice. Now for circulation of blood. The spleen is a source of qi and blood, and their accumulation and movement depend upon the spleen's ability to transform. If spleen qi is abundant, then blood production is ample, and the liver has restored blood, and the circulation of blood is normal. If spleen functions are impaired, the source of qi and blood becomes inadequate, or if the spleen is unable to command blood, then there will be deficiency of liver blood. This manifests as loss of appetite, emaciation, and oligomenorrhea or amenorrhea. So thank you for your attention.
Let's discuss diagnosis according to Sangfu organ patterns. Kidney imbalances pathology part 2. The kidneys control the body's lower orifices. As discussed, an impairment of the kidneys functioning can result in urinary incontinence. It is not only the urinary system's orifice, though, that the kidney controls the opening and closing of. Kidney qi deficiency can also result in an increased discharge from the vagina, as it is a young deficient condition. The vaginal discharge will be watery and clear. In extreme cases, the kidneys can also be so weak that there will be a fecal incontinence. This is seen in some elderly patients whose kidney qi is weakened by old age. Kidney qi is also used to hold the fetus inside the body and hold the uterus closed during pregnancy. Kidney qi deficiency can therefore manifest with spontaneous miscarriages. Kidney Jing deficiency can also mean that the fetus does not develop as it should. This can be a favor when there is a history of recurrent miscarriages. The kidneys should also hold the sperm back and keep them inside the body. Both kidney yin deficiency and kidney yang deficiency can manifest with premature ejaculation and nocturnal emissions. The mechanism is different when there is kidney yin deficiency to when there is kidney yang deficiency. When there is kidney yang deficiency, the kidney yang is not strong enough to hold the sperm back, and when there is kidney yin deficiency, the resultant heat can drive the semen out of the body. As well as controlling and producing semen and sperm, the kidneys have a significant influence on a person's libido. If kidney yang is weakened, a person can lack sexual desire. Kidney yang deficiency can also manifest with impotence. This is because there can be a lack of sexual desire, but also because kidney yang is necessary to create an erection. It is, however, important to remember that other organs also have an influence on potency and the libido, especially the heart and liver. When there is kidney yin deficiency heat, there can be an increased libido. If heat is not controlled by yin, Ming men can flare up and there will be an increase in sexual desire. Kidney yang receives and grasps the qi that is sent down from the lungs. Kidney yang deficiency and qi deficiency conditions can therefore result in dyspnea and shortness of breath. The kidneys influence their sense organ, the ears. Kidney Jing deficiency can manifest with ears that are very small or mishapen. Kidney Yin and Jing nourish the ears. If there is kidney Jing deficiency or kidney Yin deficiency, there can be hearing problems such as tinnitus and deafness, especially if there are congenital or have a develop gradually. Again, it is important to remember that other organs such as the liver also affect the ears and thereby tinnitus. Willpower, or qi in Chinese, has its residence in the kidneys. If the kidneys are strong, a person has the willpower and determination to carry out the projects that they have envisioned. That is, that the liver and Kuhn have visualized. It is this willpower to grow that is seen in a seedling that has germinated. It is determined to grow up into the light, no matter what obstacles it meets. A person with weak kidneys will sometimes lack the willpower and determination to complete projects. They will give up when they encounter resistance or become tired. The weak Qi can also result in depression because the person loses the will to live. Memory is also an aspect of the Chinese character Qi. This makes sense when we take into account that the brain is nourished by and created from Jing. As described, the kidneys are the root of all Jin, Yin, and Yang in the body. This means that when there are generalized Yin deficiency and Yang deficiency symptoms in the body, the kidneys will usually be the focus of treatment. General symptoms and signs: knee problems, lumbar problems, tinnitus and hearing problems, urinary problem with sexual function and libido, problems with infertility, problems with fertility, hair loss, dyspnea, edema, weak pulse in the chi position, general yin deficiency and yang deficiency signs. Okay. Thank you for your attention.
Let's proceed to pathogenesis, transmission of illnesses. From its onset to its eradication, a disease is a struggle between the genuine qi and evil qi. In the course of this struggle, many changes take place, and at each stage, there may be a different pattern of activities of yin and yang, qi and blood, and metabolism. This is true not only of exogenous illnesses, but also of endogenous illnesses. The site of illness and the extent of involvement are different for different illnesses or their constellation of symptoms. In general, exogenous illnesses are analyzed by the 6 meridians or the Sanjiao, whereas endogenous and miscellaneous diseases are analyzed by the visceral organs and their meridians. Many factors influence the transmission and the development of an illness. For example, the rise and fall and changes in genuine qi and evil qi, the state of the body's constitution, the geographic locale, and the changes in the weather, the living conditions, and the methods of treatment. On the whole, there are 3 aspects to the transmission and development of illnesses, namely transmission of sight, transformation between cold and heat, and transformation between deficiency and strength. The site of illness is the location that is affected, and site transmission points to the fact that in its course, an illness may shift from one side to another. Chinese medicine believes that any disease may, via the meridians, shift between exterior and interior, or between upper and lower, or among the Zangfu organs. Now let's go into exterior-interior transmission. Exterior-interior transmission includes transmission of the pathogenic evil from the exterior of the body to its interior and transmission of interior illness to the exterior. Interior transmissions of exterior illness is the process whereby the external pathogenic evil, after establishing itself in the exterior of the body, moves from the skin and hair by means of the meridians to the interior of the body, where it attacks the Zangfu organs and affects their functions. This is often seen in the initial and mid stages of the illness and reflects its deepening and worsening. Exterior transmissions of interior illness is the process whereby disease in the internal organs moves after the struggle between genuine and evil qi outward to the exterior of the body. Take measles, for example. This illness characteristically shows high fever, restlessness, chest tightness, and other symptoms. Following treatment, there is sweating, breaking of fever, and eruption of a rash on the skin. This is the manifestation of the illness moving from the interior to the exterior. The four levels of the warm diseases represents the usual transmission of illnesses of heat. In general, the progression is from the defensive level to the chi level, then to the nutritive level, and finally to the blood level. This progression reflects transmission from the exterior to the interior and the deterioration of the patient. Thank you for listening.
Pathology of Minister Fire in emotional problems. This time we discuss Yin Fire. The concept of Yin Fire was introduced by Lee Tong-yuan in his book, Discussion on Stomach and Spleen. Dr. Lee says that as a result of improper diet and overwork, the original qi or yuan qi becomes weak in the lower burner. This causes the patient to feel tired and often cold. When the patient is also subject to emotional stress, the minister fire is stirred. It becomes pathological and it leaves its place of concealment in the lower dantian. Moreover, as the minister fire and the original qi reside in the same place in the lower dantian, the pathological minister fire displaces and weakens the original qi even more. Dr. Lee said that the pathological minister fire becomes a fifth of the original qi. The arousal of the pathological minister fire upwards causes some heat symptoms in the upper part of the body, such as a red face and mouth ulcers. This he called Yin Fire. Yin Fire is neither full heat nor empty heat, but simply a different kind of heat that derives from a deficiency of the original qi. It follows that Yin Fire is not treated by clearing heat or draining fire, but by tonifying the original qi and gently clearing heat upwards. So here we see the pathology of Yin Fire. Pathological minister fire will harass the heart and pericardium as a result of involvement of the minister fire. Then this will lead to anxiety, depression, feeling of heat on the face and red cheeks. The minister fire will displace the original qi or yuan qi, which will lead to deficiency of stomach and spleen, exhaustion, feeling cold, and cold feet. The pathology of Yin Fire is further complicated by dampness and by a pathology of the middle burner as well. When the spleen is deficient, dampness is formed, and this infuses down to the lower burner. Here, it swaps the original qi and the minister fire, displacing the latter from the place, the lower burner, where it should be concealed. So here we see the pathology of Yin Fire and dampness. This is as a result of weakening of the spleen, leading to dampness. So this will displace the minister fire from the place of concealment, and if this will lead to a minister fire that is altered, which will lead to Yin Fire. So emotional stress can actually aggravate. So there is feeling of heat, thirst, red face, red tip of tongue, and as spontaneous sweating, tiredness, shortness of breath, pale tongue, and weak pulse as well. So this is pathology of Yin Fire and dampness. The middle burner has dampness too. Spleen Qi or even spleen Yang is deficient and fails to rise. For this reason, Bu Zhong Yi Qi Tang, tonifying the center and benefiting Qi decoction, is used to raise spleen Qi and warm spleen Yang, so that dampness no longer infuses downwards to the lower burner. When the lower burner is opened and unblocked from dampness, the minister fire will return to its place of concealment in the lower burner, thus eliminating the symptoms of Yin Fire. Any emotion can lead to Yin Fire, as all emotions may stir the minister fire out of its residing place in the lower dantian. All emotions lead to qi stagnation, which in turn eventually leads to some heat. The situation can be aggravated by the presence of dampness in the lower burner, as happens in shame. This accounts for symptoms of heat in mental emotional problems that may defy a classification into full or empty heat. This happens when there are symptoms of heat above, which is manifested as red face, thirst, feeling of heat in the face, and cold below. Cold feet, general cold feeling. Such situation is due to Yin Fire. Emotional stress is more likely to lead to Yin Fire when it is combined with overwork and dietary irregularity. The acupuncture treatment of emotional stress manifesting with Yin Fire should be based on the following steps. First, we tonify the original Qi via Ren 4, lift the Qi via Do 20 and Ren 6, clear the heat in the upper part of the body using P8, P7, Li4, Lung 7, Ren 15. Calm the mind using Do 24, Do 19, and Heart 5. Regulate the triple burner using Triple Burner 6 and Triple Burner 5. In summary, Yin Fire for emotional problems will manifest as red face, thirst, feeling of heat in the face, depression, anxiety, general tiredness, cold feet, general cold feeling, red tip of the tongue, but pale tongue, and weak pulse. Thank you for your attention.